Hello and welcome to another episode of PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas. Today's episode tackles a public health issue of increasing importance, not just here in Georgia, but around the globe. And Phaedra, that's the rise of Alzheimer's disease and the related dementias in an aging population and the need for memory care.
So, you know, Cham, we've talked about aging issues on several other episodes of PHI, but in today's show, the reason why we're bringing it up again is because our state legislature will be confronting these issues this session.
Well, that's good because there are 5.4 million Americans now living with Alzheimer's. It's the most common form of dementia, and we expect these numbers to surge.
You know, the G8 recently held a summit that was focused specifically on Alzheimer's, and they released some really interesting statistics. There are currently 44 million people living with Alzheimer's globally, and the kicker is this is going to increase to 135 million by 2050. That is really amazing.
Well, that creates a real problem since, as you know, right now there is no cure yet for Alzheimer's, and right now there are no real effective treatments.
Mortality is a problem as well. It's the sixth leading cause of death in the United States, which means that 1 out of every 3 seniors dies from Alzheimer's.
And of course that's going to mean that it's the leading cause now for long-term care, or the need for long-term care, and this has tremendous emotional and financial costs.
So we'll be going down to the Capitol to talk to some of our leaders to find out what they're doing to confront the problem of Alzheimer's in the state of Georgia. We're now in the state capitol, and I'm being joined by Dr. James Bulot, who is the director of the Division of Aging Services. Thank you so much for joining me today. Can you tell us about the aging population here in Georgia?
So Georgia, like a lot of other states, is quickly aging. Unlike a lot of states, we're one of the fastest aging states in the country. When I arrived here in Georgia, we were the 8th fastest aging state. Over the last 3 years, we have become the 6th fastest aging.
Wow.
And that's overall.
Why?
Well, you know, there's a number of factors that contributes to the aging of the population. One of them is just longevity. So we have better health care, we have better medicine, better technology, and that's allowing more people to grow older. But you also have some unique demographic variables here in Georgia. One of them is this climate. So a lot of individuals are migrating to the state of Georgia because of the climate. It's not too severe. We don't have blizzards. We don't have hurricanes, at least not too many. So it's a nice destination for folks. Georgia has historically been a state that had a lot of in-migration of younger individuals. So you have young people moving here for jobs, and they stay here in Georgia. And then you have their relatives, their family members, grandparents moving to be near their grandchildren or their families. So you see that happening. And then you just have the aging of the population that I would say has always been here. Mm-hmm. The folks who grew up in Georgia, they worked in Georgia all their lives, and now they're growing old here, and that group is growing as well. So all those factors contribute to make Georgia one of the fastest aging states, which I guess creates its own unique problems compared to states that see their population shrinking, and many states do have shrinking older adult populations.
So what is the goal of the GUARD task force?
Well, let me start by telling you what GUARD is.
Mm-hmm.
GUARD is the Georgia Alzheimer's and Related Dementias Task Force, and the goal is for us to start looking as a state on how do we plan for a significant increase in the number of individuals with Alzheimer's and related dementias. What services do we need to have available? What resources we need to make available? What changes need to happen in the state of Georgia to help us assist these individuals with growing old, remaining in the communities, remaining vital parts of the community? So are we educating students? Are we educating healthcare providers to address the needs of an aging population? And in specific for the GUARD task force, aging population that has a high prevalence of dementia. And we need to make sure as academics, as providers, that we have the skills necessary. You know, when we produce teachers, we make sure they can teach math, English, science, whatever their discipline will be. And from all the other arenas, we need to make sure that we have a competent workforce. And GUARD is looking at those types of issues right now.
So what kinds of people are on the task force, and what are some of the areas that the task force is looking into?
Okay, well, I chair the task force, but I'm probably the least important person. The folks who are the important folks are all the committee members and all the advisory panels. So we have again, our elected officials, they're the ones who ultimately have to carry any legislation that comes about. Senator Unterman, Representative Benton, Representative Cooper. And then we have the identified individuals in the legislation. That is the Commissioner of Public Health, because Alzheimer's is a public health issue. It is the Commissioner of the Department of Community Services, and it is me as Director of the Division of Aging Services. So we make up the primary core group of the GUARD Task Force, and then we have the advisory panel. And that's the group that's been so essential to, I think, will ultimately be the success of the task force. That's academic institutions like UGA, GSU, Mr. Rosalind Carter Institute. We have service providers, individuals who are the ones providing the direct service. We have consumers. We have family members. We have researchers, the medical researchers. We have social researchers. And it's just I mean, I sit in a room and I'm always and very impressed and humbled by the expertise that's there. Because usually when you're in my position, you're talking to folks and you realize how little individuals know about the aging population. And when we're talking to the panel, they're very knowledgeable. They know what's going on both locally, but also nationally. And that's been so beneficial to us as a task force.
And why don't you tell me about what are some of the current and emerging issues that the task force is going to address?
Well, some of the ones that we're getting some early traction on is the data and research. We've identified that as a state, we don't know very much about the prevalence of Alzheimer's in Georgia. We know we have the national data, and we know some of our data reflects some of the national numbers, but whenever we try to plan for services, we really need to know down to the county level sometimes how many individuals have Alzheimer's. Is this a particular issue in that county, in that region, or there individual services that need to be targeted to this area? So that's one of the areas, and it's looking like the task force has recommended the creation of an Alzheimer's registry to kind of capture and get at that level. The service provision. What services do we have and don't we have for individuals with Alzheimer's disease? That's being headed up by the by Commissioner Reese and the Department of Community Health, looking at state infrastructure to deliver the state-funded services for Alzheimer's disease. Community resources. That's another one. That's a community outreach group, and they're looking at how do we partner with all these other groups who have an interest in Alzheimer's and dementia, and how do we make sure we get the same message out, raise the prevalence, raise the knowledge about Alzheimer's. Early diagnosis, we know over and over and over again, is key to treating right now until we have a cure. And that's getting down to the local level. That's a grassroots effort. It's working at the state level, but then it's getting down locally. So those are some of the key committees. We have public policy that's looking at the state laws, looking at laws that may need to be created to make sure services are available, it's making recommendations on funding. It's looking at a wide array of things, and that group will ultimately feed any potential legislation now and in the future to our elected officials as far as changes that need to happen.
Great, thank you so much for your time. And now we'll be looking at some of the subcommittees as part of the GUARD Task Force. I'm now being joined by Dr. Toni Miles, who's also with the Institute of Gerontology and the College of Public Health. Toni, what subcommittee are you working on?
I'm on the data subcommittee for the GUARD Task Force.
So who is the chair of your committee, and what are the goals of your committee?
Dr. Brenda Fitzgerald, who is a state commissioner for health and also the director of Georgia's new public health department, is our committee chair. And our goals are basically to provide data for every committee that needs it.
And why is this important?
The best reaction to a public health issue is based on what is out there. And so the task force in general is trying to count the number of heads, trying to feel the impact of a growth of a population with dementia. All of those aspects are wide-ranging, so you really need data to do that.
And what kind of data do we have available here in our state? I mean, do we have enough data to provide to all the other subcommittees, or do we have gaps?
What we start with is the wonderful online statistical system called OASIS. Georgia is probably one of a few states that has really readily available online data. So you can make maps and do charts, and it links up with all the other databases, so we start there. But of course, dementia is one of those things that is newly evolving, so there are gaps in that database.
So how does one measure dementia within a community?
I mean, ideally, and this is a conversation we've been having since July when we started our work, is it would be ideal to have people with diagnosed cases, ICD-9 or ICD-10 codes, but that doesn't exist. It's way under measured.
Does it exist for Alzheimer's?
There is an ICD code for Alzheimer's, but that's not the only cause of dementia.
Right.
And it's underdiagnosed. And so we've been talking about indirect measures of the presence of people with dementia, particularly undiagnosed dementia.
Okay, so what would those indirect measures be?
Traffic accidents in people who are over age 50 are one indicator. That's not the only cause of a traffic accident, of course, but that's a good indicator. Emergency room use, hospitals for people with cognitive issues, behavioral problems. So we are developing this sort of indirect way of capturing people who have altered cognitive performance.
Well, let's talk about the growth of the population. I think we've talked before about kind of migration to Georgia. What does that look like?
Well, the Census Bureau says that for the past 30 years, we've had about 50,000 people over the age of 50 migrating into the state. If you drill down to a county level, for example, Gwinnett has had 20,000 additional people over the age of 45 every 2 years since 2006.
Wow.
So it's an active process, and I don't think most of us realized it was that big.
And what are the top recommendations coming from your committee?
Data, 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 in an organized fashion that serves the needs of the other committees. So if there's a workforce committee, they need data on the presence of people who can fill the jobs that need to be filled. Public safety is an issue. The new HB 78 law on elder abuse requires data. And so will that law influence our injury statistics for older adults? So there are all kinds of important data questions that will help the state manage the cost of a growing population.
Great. Thank you so much for your time.
I'm now joined by Ann Glass, who is a faculty member in the Department of Health Policy and Management and also in the Institute of Gerontology. Ann, why don't you tell us which subcommittee you're involved with?
I'm one of many advisors to the Service Delivery Committee, and that's chaired by Commissioner Clyde Reese of the Department of Community Health.
And can you describe to me what you mean when you say the term service delivery?
Service delivery can include the way services are delivered in terms of the training that we provide staff and the housing that we provide for folks with dementia. And then there are a lot of other things, like even simple design things. For example, using a contrasting toilet seat I mean, that's a very simple thing, but it makes it much easier for people who have dementia. So there's a lot of things we could be doing that will help improve services.
And how did you as a faculty member get involved in this particular topic?
How I was pulled in was to look at what other states and in particular what other countries were doing. And I had the opportunity in the spring to travel to the Netherlands and visit several of their elder care and housing options. And they are really ahead of us in many ways.
Why don't you give us an example of something they're doing?
Okay. A couple things maybe. One is they have already developed several what you might call small houses, which are for people with dementia, 6 residents, each have a private room, and then it opens into a kitchen, living room, dining room, so it's much more home-like and much more person-centered. Another option is to tuck in adult day programs into larger facilities, like a retirement community, if they could dedicate just a few rooms and use it for a small adult day program. This would provide respite to family caregivers who are taking care of a person with dementia, and it's also a smaller program, so it's not as stressful for the person with dementia. And it would also make them more accessible. We could have them far more commonly available.
It sounds like they're doing really innovative things in the Netherlands. How easy do you think it would be to translate what they're doing here to the United States? What might be some of the obstacles or the opportunities for the United States?
There is already recognition of the idea of the small houses or greenhouses, as they've been called here. Bill Thomas was a physician who has led a movement in that direction. So there's some recognition of that already, but it does take some legislative changes, and also it always comes down to money too. But there's definitely ways that even an existing nursing home could be retrofitted to make it more into that small community idea.
And how about the state legislature? What role might they play in trying to bring these innovative ideas here? Is there certain rules they can pass in Georgia that might impact this?
One of the things I think on our list is dealing with licensure of adult day services programs, and that would have some impact on having the small programs I was talking about. Another thing that we are promoting is there's a National Dementia Initiative white paper that came out just this year, and it's got a lot of wonderful information in it, but one of the key things, and this goes back to delivering services, whether you're the family caregiver or a provider, is to look at the behavioral problems that you sometimes see with people with dementia as behavioral expressions. And if you can figure out what it is they're trying to tell you and then address that issue, everybody's going to be much happier. So that's part of our recommendations as well.
So Anna, is the white paper publicly available?
Yes, it is, and actually to make it easy for the listener, we have it available, a link to it on our website at the Institute of Gerontology, and also if you're interested in more information about the Netherlands experience, that's available on the website too.
Okay, great. Thank you so much.
Thank you.
Kerstin Emerson is here with me now. She's a faculty member in the Department of Health Policy and Management and a gerontologist. Kerstin, why don't you tell us what is the subcommittee that you're involved with?
I'm a member of the Workforce Development Subcommittee on the GUARD Task Force.
Okay, and what is the role or the purpose of that subcommittee?
Well, Tommy Benton is the head of ours, and he's the representative of the District 31 in Georgia, and his main interest is to look at workforce development, and in kind of a broad sense, there's a lot of areas that we need to increase, not just in generally in aging, but in specific dementia training and how to handle people with dementia respectfully and appropriately.
So why is this an important issue?
There's really two areas that makes it really important. One is that we don't have enough workers. There's a shortage already. We have half the amount of geriatricians, which are medical doctors focusing on aging, right now in the country, and that need is going to increase. And only 1% of people graduating from medical school are going into geriatrics, so it doesn't look like it's going to get much better. We have half the amount of geriatric psychiatrists. We're just missing a lot of workforce development already, and it's going to get much worse.
And is that only on the physician side?
No, that's a good question. It's actually on pretty much all sides. By 2030, one of the studies just showed that we're going to need 3.5 million direct care and healthcare professional workers. So that's going from direct care workers in nursing homes all the way up to a specific specialty in geriatrics.
And what are we doing here at the University of Georgia to prepare the workforce?
It's a very good question. We're trying to do it at different levels. We have some just basic introduction classes at the undergraduate level to get people exposed to it, but also we have specific programs where in the College of Public Health we have a graduate certificate in gerontology, and brand new we have a master's in public health which focuses on aging. So that's part of our goal, is to get the people that are here to be interested in the topic.
Wow, that's great. So an MPH in gerontology or aging?
Yes, in aging, yes.
And is that pretty common for MPH programs?
It's not. It's actually fairly unusual. There's about 5 or 6 in the country, so we're kind of at the forefront of developing that with the recognition that as we go in the next 10, 20 years, as the statistics keep telling you, we're going to need more and more people that are aware of the problem. We need to get more people into the workforce, but also get people who are in the workforce educated on the issues.
Right.
So we have people who are working already that don't have any training in dementia and how to handle people appropriately. And that can be people that are already working in the healthcare workforce, but also people like policemen or post office people who see people every day that have dementia symptoms but don't know to recognize them and don't know how to handle that appropriately.
So what are going to be the top recommendations of your committee?
Well, after a lot of debate and a whole lot of suggestions, we've narrowed it down to 4, and none of them need legislative actions, which is good, but all of them need funding, which is, of course, always an issue. Our first one is just to do a needs assessment. What do we actually need in Georgia? There are a lot of national statistics that we know, but in Georgia, where are the gaps in our workforce? What are we going to need in the next 20, 30, 40 years? So that's a simple, straightforward one. And then we want to educate the people that are already in the workforce, maybe tie it to licensure and certifications, which we already have, give dementia sensitivity training to people in the workforce. Our third one is to get more people into that workforce, attract people. There's a lot of different ways to do that. We've suggested some in our recommendations. One is to do maybe a loan forgiveness program or stipends to people going into education, possibly housing subsidies, something to encourage people that are taking time out to go and maybe study on something specific. Our last recommendation is to keep them in the workforce. There's a huge, over turn in the healthcare field, and we want to keep people in, especially our good workers. And so one of our recommendations is to, of course, increase benefits, which is hard to do, and there's quite a bit of discussion about that. But there's other ways we can do it too, is we can do career ladders for people that are really good and obviously are qualified, and how to keep them in that workforce is maybe to encourage them to become managers, to train the next set of people, and show kind of a clear way to step up in the career and keep them in our workforce.
And so why are you, as a faculty member, interested in aging, I guess, in general, but also workforce issues as a part of that?
I think the numbers speak for themselves. I think we're going to have more and more people that are going to be an aging population, and I like older adults in general, but if you just look at the trends, no matter what job you're in, you're going to be dealing with older adults. People who never thought they would see older adults in their practice or in their day-to-day workplace are seeing them. And people should at least have some basic awareness of it, and that's my passion, is to at least introduce them to the topics and get them to understand how to deal with people that are aging, and especially ones that have dementia, and how to deal with them respectfully and appropriately.
Great, thank you so much.
Thank you.
I'm now being joined by Senator Unterman, and Senator, you have been such a champion for public health, and aging now is another issue that you're heavily involved in. Can you tell me why you care so passionately about this topic?
I've always cared about aging, and I think it goes back to my relationship of being a nurse and a social worker. And when I first got into politics, I started getting involved with the senior citizens when I was the mayor of a city. And, you know, once you get those roots in that thought process in your mind, you know, 20 years later, I still care very much about that topic and wanted to do something positive. And throughout my career, I have worked on aging issues, whether it's dementia or Meals on Wheels or congregate living, you know, the three-tier system of taking care of elder people in assisted living, nursing homes, or wherever. But I've always been interested in, and now that I'm a senior citizen, I'm really glad that I was interested all those years.
So we've learned a lot about the GUARD Task Force. Can you tell us a little bit about, you know, your thoughts about how the task force has gone, and kind of what's the next step for the task force?
I've really been overwhelmed. I've worked on a lot of topics here at the Gold Dome, and I've been overwhelmed by the support because people are so passionate. And every time I have a meeting or go into a meeting, there's at least 75 people there. And it's usually family members or special interest groups in aging that are interested in the topic. But it's a wonderful thing because it's such a crucial issue.
So let's summarize, what is the ultimate goal of the task force?
The ultimate goal of the task force is to develop a statewide plan. 40 states in the nation have a statewide plan, and unfortunately Georgia is one of those states that does not. So our goal is to adopt that in the General Assembly so it's codified, it becomes a law. And that's a footprint for the next 10, 20, 30, 40, 50 years for the state of Georgia to be able to take care of the aging baby boomers who are going to be a huge physical burden on the state. But this will set the plan and set the agenda of how to do that.
So I know there's lots of good recommendations coming out of the task force. Should we expect to see legislation in the future?
Yes, I think we're going to have two pieces of legislation. One is related around a database because we really have no confirmation of who and where these people are that have dementia, and forecasting. And that's the most important thing, the implications on the state appropriations, the fiscal affairs of the state of Georgia, of how in the future we're going to take care of these people. The other issue that I'm working on for this next session is the appropriations budget. I would like to see more money put into the budget for community-based and in-home services for people with dementia. When you look at the impact on the family, it's just critical that you can be able to help maintain that family structure and keep people in their home as long as they can, or have guardianship and protect those people that are affected, because it's just such devastating effect on the family structure. And I believe that that money is well spent. That you know, my fiduciary responsibility is to look after the state budget, and you're actually saving money by keeping people in their homes.
Great. Well, thank you so much for your efforts.
Thank you. Thank you.
In today's show, we had a wonderful overview of what the state of Georgia is doing to tackle this difficult problem of Alzheimer's. But what we didn't talk about, Cham, was how Alzheimer's and dementia impacts the caregiver.
Yeah, most people think of caregiver in the professional sense, somebody who's trained and paid to do this kind of work. And they're very important, but really the backbone of care for Alzheimer and dementia of all kinds is the family and the friends who bear the brunt of this and are really the most important factor.
So you know, Cham, our producer of this show, is a caregiver. His parents are experiencing Alzheimer's and related dementia, and we've learned a lot from him about the impact that this illness has had on his family in terms of finances, the time that it takes to care for his aging parents, and then of course the stress it has on their own family relationship.
Yeah, in addition to the costs for the patient, which we seem to focus on, the cost for the caregivers in 2012 was over $9 billion.
So if you or someone you know is impacted by Alzheimer's, either personally or as a caregiver, there are resources available, and we've listed a few on the screen here.
So thank you for being with us today for this really critical episode on Alzheimer's and other dementias. And join us for the next episode of PHI, Public Health Impact.